guys, welcome back to our channel. Today we're going to be going over hypos of a few electrolytes. So to begin with, we're going to be going over hypokalemia, which means that you have low levels of potassium within the bloodstream. So looking at some causes, so it could be due to a decreased intake by the patient themselves. It could also be due to redistribution into the cells, meaning that the potassium that was in the extracellular fluid is now being uptaken into the intracellular fluid. So things that could lead to that would be metabolic alkalosis, insulin, and beta-2 agonists. For example, albuterol would be in that category. It could also be due to an increased loss of potassium. And so this can be associated with diarrhea, excessive sweating. You could be using a diuretic such as a loop or a thiazide, which could be causing you to lose that potassium. Also hyperaldosteronism. So now moving down to the treatment. So if you have a patient who has hypokalemia, you're going to be treating with potassium chloride. One thing to note with this is that you have to do either a central line or oral, because if you do IV, it will mess up the line. So now moving over to hypomagnesemia, which means low magnesium within the bloodstream. So again, causes. So diarrhea could be a cause. Those diuretics again. PPIs, which are used for GI problems, alcoholism, hypercalcemia, diabetes that is uncontrolled, and acute pancreatitis. Treatment with that is going to be magnesium sulfate. So now we're going to move over to albumin indications. So these are times when you're going to be using albumin and providing it to your patient. So the first one is hepatorenal syndrome. So this is where there's a problem with the liver, but for whatever reason it's going to affect the kidneys. So you have very healthy, normal kidneys, but there's something that's going on within your liver that's going to affect the kidneys, and at that point you're going to be providing your patient with albumin. Large volume paracentesis. So this could be a patient who has like ascites, and you're going to be removing all of that fluid. With that, you're going to be taking albumin, but then what happens is that fluid is going to redistribute to that area, so you're taking even more albumin to provide into that area, so you're going to want to be providing those patients with albumin as well. Liver failure, so these are patients who have severe edema and they're hypoalbumin. So again, that's kind of intuitive, you're going to provide them with albumin. And then spontaneous bacteria peritonitis is another cause in which you would provide your patient with albumin. So again, I went over kind of like the hypos, some causes and indications, and treatment here. So thank you.